Violence against women is a public health issue. I think of practice and research kind of coming, I mean, they're like intertwined, and I mean, it's really what drives me. I recently received a grant from the National Institutes of Health to focus on the role of college health centers in screening women for violence. And the focus of the grant really is to look at the role healthcare providers in college health centers play, as well as what women's experiences were when they went to college health centers in terms of were they, do they remember being asked about intimate partner violence, sexual violence, alcohol and tobacco use. Not only is it about the patient and the provider, but it's also bigger in terms of thinking about organizational factors and organizational culture that really support screening for violence. We do know that there are recommendations out there to screen women for intimate partner violence and sexual violence in healthcare settings. And so really the question becomes is how, again, do we translate these guidelines and these policies into practice, and what are the best ways to do that? This is a project and an idea and research that needs to be done. We know very little about college health centers and screening for violence, and so this is the beginning, and the goal will be to finish this grant and take this data and eventually develop an intervention that's theory-based and tailored to the needs of healthcare providers and college health centers. I now walk to work. It's about 1.3 miles a day, and it's been one of those things where now I teach public health. I teach a public health course, and so when I talk with the students and give examples in class, I talk about how I do walk to work, but I also live in a neighborhood where it's safe to walk to work. It works really well when I have discussions and lecture about social determinants of health and where we live, work, and learn how those factors impact our health.